Hi everybody, and welcome back to another one of our Why Wednesdays here at Mercy Grace Private Practice. Today we're talking about skin cancer. So May is actually Skin Cancer Awareness Month, so that's why we wanted to take a brief moment to talk to you about skin cancer and the importance of early detection and prevention. So skin cancer is an abnormal growth of skin cells. This is caused by prolonged UV exposure. This can be from the sun or from tanning beds. And there's three different kinds of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. Melanoma is the most dangerous and the most serious because of the risk of it spreading. It tends to metastasize or spread to other parts of the body. Skin cancer is a very preventable and treatable cancer, so early detection is essential for treatment. So it's important that you recognize these moles and follow up with your healthcare provider as soon as possible, because the earlier the treatment, the better the outcome. And prevention, it is one of the most preventable kinds of cancer by wearing your sunscreen, by wearing protective clothing, by wearing hats, long sleeves, these kind of things outside, especially if you're going to be outside for any prolonged periods of time. That can help prevent the skin cancer. And wearing your sunscreen every single day, even though you are inside, can help prevent it as well. So for early detection, you can use the ABCDE rule. So the A stands for asymmetry, so if one side of the mole doesn't match the other side of the mole, this would be a reason to follow up with your healthcare provider. B is the border, so the border of the mole or the skin pigmentation area, if it is irregular, ragged, or blurred. C is for color, so if it's not uniform in color, if it's several different shades of color, or different shades of brown, pink, black, red, white, or blue, this would be a reason to follow up with your healthcare provider. D is for diameter, so if the spot is larger than 6 millimeters, which is about the size of a pencil eraser, although melanoma can be smaller than 6 millimeters, so if you recognize any abnormal mole at all, go ahead and follow up with your healthcare provider. E is for evolution, so if the mole is changing in color, shape, size. If you notice any of these abnormalities, it is important to bring attention to your healthcare provider and follow up with them as well, or follow up with your primary care provider or a dermatologist just to get a thorough medical examination of the mole or the skin discoloration area. So like I said, early detection and prevention are key for preventing any sort of skin cancer or treating it early. If you have any other questions, we have the link below for the whole blog post with more information, or you can always comment questions and we'll be happy to answer. We hope you have a good rest of your Wednesday, and we'll see you next week.